Hello all, I am Mrs. Vinnie Matthew, nursing tutor working with Oyster Nurses Academy, Tiruvalla. We provide guidance for the prometric examinations to different Gulf countries: Saudi, Oman, Qatar, Bahrain and UAE. Today we'll see about cervical dysplasia. Cervical dysplasia is a precancerous condition in which abnormal cells grow onto the surface of the cervix. Another name of cervical dysplasia is cervical intraepithelial neoplasia, or in short we call it as CIN. We'll see about the classification of CIN. A more recent system classifies disease severity based on how much epithelial tissue in the cervix has abnormal cells. First classification is CIN 1. It refers to the abnormal cells affecting about 1/3 of the thickness of the epithelium. Second classification is CIN 2. It refers to abnormal cells affecting about 1/3 to 2/3 of the epithelium. Third classification is CIN 3. Refers to abnormal cells affecting more than 2/3 of the epithelium. CIN 1, cervical dysplasia, rarely becomes cancerous and often goes away on its own. CIN 2 and 3 are more likely to require treatment to prevent cancer. Moving on to the symptoms. Cervical dysplasia does not usually cause any symptoms. Instead, the healthcare provider may diagnose the cervical dysplasia after finding abnormal cells during a routine pap smear. Some people may have irregular vaginal spotting or spotting after intercourse. Moving on to the causes. Infection with human papilloma virus. This is a virus that spreads through sexual contact. About 50% of HPV infections occur between the ages of 15 and 25. Often, the infections goes away without causing permanent problems. In rare cases, abnormal cells form over time, leading to cervical dysplasia. Moving on to the diagnosis. Healthcare provider will most likely to notice signs of cervical dysplasia during a routine pap smear test. If the pap smear is unclear or reveals abnormal cells, the next step might be a colposcopy to examine the cervix. Moving on to the treatment. Treatment depends on various factors, including the severity of the cervical dysplasia, age, health, and treatment preferences. First one is monitoring the abnormal cells. The majority of low-grade cervical dysplasia, that is CIN 1, goes away on its own. Only about 1% of cases progress to cervical cancer. Periodic pap smear tests should be done to monitor any changes in abnormal cells. Second treatment option is removing or destroying abnormal cells. If the cervical dysplasia is more severe, remove the abnormal cells that may become cancerous or destroy them. These procedures includes loop electrosurgical excision procedure. It uses a small electrically charged wire loop to remove tissue. Second procedure is call knife cone biopsy, removing a cone-shaped piece of tissue containing the abnormal cells. It is reserved for more severe cases. And the third procedure is doing the hysterectomy. Then, how do we prevent this condition? The only way to prevent cervical dysplasia is to avoid getting HPV. By getting vaccinated against HPV, practice abstinence or safer sex, get regular pap smears, don't smoke or use tobacco products. Thank you. See you all soon with a new video.